So first of all, I'm honored that I've been invited by Ashley Levinson and PCOS Challenge to talk about heart disease in women with PCOS on the 10th anniversary of the PCOS Challenge Heart4PCOS initiative. Today, I'd really like to talk about the American Heart Association Essential 8 Cardiovascular Disease Risk Factors. I'd like to rate the importance of each to a woman with PCOS from my perspective, both as a clinician and a researcher, and not only review diagnosis, but also treatment recommendations for those that have that risk factor. So you can easily Google the Essential 8 on the American Heart Association. These are felt to be the 8 modifiable cardiovascular disease risk factors. You know, there's some risk factors that aren't modifiable, for instance, congenital heart disease or a genetic predisposition to heart disease. But these are the modifiable ones, and these are the ones that we focus on in our research and clinical practice. So I'm going to rate them from what I think are the most important to recognize and reverse to the ones that are less important. Obviously, all of these are important and essential. So first, I'm going to rate quit tobacco. Now, why do I say this? The majority of women with PCOS do not smoke, but in medicine, a lot is compared to what? And in our studies, and I also do a lot of research in other patients who are infertile, the rate of smoking is always higher among women with PCOS. So again, I think if you smoke, that is probably the single most beneficial thing you could do to modify and improve your cardiovascular risk would be to quit tobacco in any form, whether it's vaping, smoking, cigars, most important. Second is to manage blood sugar. We know that women with PCOS have increased risk for glucose intolerance and for type 2 diabetes. We also know that in women, glucose intolerance in and of itself is a cardiovascular disease risk factor. So again, I think women should be screened at a minimum with a glycohemoglobin or a hemoglobin A1C level, and preferentially with a glucose tolerance test. And again, I think that should be addressed. When glucose intolerance is present, the goal is to reverse it. Third is manage blood pressure. Generally, we found that women with PCOS tend to have higher blood pressure than other women. We know that women with PCOS are at increased risk for pregnancy-related complications from blood pressure, so gestational hypertension, preeclampsia, eclampsia. So again, I think recognizing blood pressure both before and after pregnancy and during pregnancy and treating it is critical. And you know, what I've seen evolve over the years is certainly for those patients with diabetes, we have a much more aggressive recognition and treatment of blood pressure. The upper limits of blood pressure keeps coming down for what we should treat. We've now seen with the CHAP trial, which is a recent trial in women with gestational hypertension that showed that aggressive treatment of hypertension led to better maternal and fetal and infant outcomes. So again, I think this is the third most important risk factor to focus on. Fourth, I'm putting managed weight, and I know that for many of the patients that come to clinic, this is their number one issue. But in many cases, there are many women who are overweight or obese that have none of these other risk factors. We have a category for that. It's called metabolically healthy but obese, MHO. And again, I think it's treating the glucose and blood pressure, to me, are the number one issues if they exist. And then weight, certainly that's important. I'm not downplaying it. But I do think one of the things that we've learned through our studies, whether it is conventional treatment with caloric restriction and increased physical activity, whether it is with pharmacologic medications, or whether it is with bariatric surgery, women with PCOS lose weight at the same rate as other women who undergo those therapies. And again, this is meant to be optimistic that therapies exist and women with PCOS respond to it. Unfortunately, I can't say that there is an inherent predisposition to either weight gain or weight retention in women with PCOS or obese compared to other women. I think that's a metabolic issue that we're still trying to answer. This last is get healthy sleep, and I've elevated that, and this actually, the American Heart Association changed. They used to call it the Simple 7 cardiovascular disease risk factors, and just this summer they added healthy sleep as a goal, and switched it from Simple 7 to Life's Essential 8. And one of the things that we found about sleep is that if you sleep poorly, if you have sleep apnea, if you have disordered sleep breathing, is that there's a vicious circle that exacerbates the metabolic abnormalities associated with PCOS and also with type 2 diabetes and other underlying cardiovascular risk factors. So, to break the vicious circle, it's really important, first of all, to get diagnosed. So again, if you find yourself sleepy during the day, if you hear that you're snoring at night, if you have a lot of difficulty falling asleep, I would definitely recommend considering a consult with a sleep specialist because there are now many treatments, and there's also many different diagnoses that can contribute to sleep disorders. I've added eat better and be more active. I mean, these are well-proven strategies for improving cardiovascular health. And again, I think these are things I'm not aware of any predisposition of women with PCOS to be either to eat poorly or not to be active. These are things that we as a society aren't doing well, and as we as a society must improve on. I've added controlled cholesterol last, not because it isn't important. You can argue that it is as important as glucose and blood pressure. I only add it because, and I'm not talking about women with PCOS also have familial hyperlipidemias. Those need to be recognized early. It's that most treatment for dyslipidemia related to metabolic health tends to kick in women who are 40. Again, most of the women that I see are well under the age of 40. And it's uncertain whether women who are under the age of 40 who do not have other familial hyperlipidemia should be taking lipid controlling medications. One of the issues is that statins, which are the most commonly used issues, generally are discouraged during pregnancy or women seeking pregnancy. We obviously discontinue those and doing that because of the unknown effects on pregnancy and especially on the fetus. So to summarize, cardiovascular disease is the leading cause of death in women with PCOS, in fact, in women throughout the world with or without PCOS. Women with PCOS display multiple risk factors for cardiovascular disease. Priority should be placed on improving risk factors which disproportionately afflict women with PCOS. And again, those are smoking, glucose intolerance, and hypertension are the top three in my book that we should focus on. So thank you for your attention, and I look forward to next year's campaign for this important disorder.